Anybody need a sound check? Check 1, 2. Testing podium mic for 1 p.m. press conference. Check. Test 1, 2. Testing. Check 1, 2. Check, check. Testing 1, 2. Check, check. Testing podium microphone for press conference at 1 p.m. San Francisco City Hall. Check 1, 2. Check, check. Testing 1, 2. Wait. Good.
SF TV, San Francisco Government Television.
right. Good afternoon, and thank you everyone for joining us here today. My name is London Breed. I'm the mayor of San Francisco. I'm joined by President of the Board of Supervisors, Norman Yee, along with other members of the Board of Supervisors, the Director of the Department of Public Health, Dr. Grant Colfax, our Police Chief, Bill Scott, and the Department of Emergency Management Director, Mary Ellen Carroll. Again, I want to thank everyone for joining us here today. As you know, the city has been working to prepare for what we know would be a significant public health challenge here in the city, and we are seeing it play itself out all over the Bay Area and all over the world. And as the city prepared its response, we explained to the public that we would be clear every step of the way what the challenges are, also the steps that we would need to take in order to protect public health, and some of the challenges that we have, of course, faced from an economic standpoint as well. And every step of the way, I want to thank not only members of the public for your understanding, but I really want to take this opportunity to thank so many of our public health staff, people who have been on the front lines, as well as our public safety folks who work for the city, people who have rose to the occasion and have tried to help us through what we know continues to be an evolving situation and a very challenging one. But I also want to say that San Francisco has, as we know, experienced challenges in the past. And because of those challenges, we have become more of a resilient city. That is why we took the step before any other cities to declare a state of emergency so that when this happened in our city, we were prepared. And we are prepared. But we also know that there are some very, very significant things that need to be done, some significant steps, even more so than what was announced by the governor in order to ensure public safety. And so today we are announcing those steps and what we need to do. And part of what we are also seeing is definitely a change in behavior, a change in what people do in our everyday lives. Many are calling this the new normal. Well, it's the new normal temporarily in an effort to protect public health. That's what this is about. And again, we appreciate everyone for your cooperation and all of those folks who continue to be on the front line helping us to combat what we know continues to be an evolving situation. The new public health order that we're announcing will require San Franciscans to remain at home with exceptions only for essential outings. These measures will be disruptive to day-to-day life, but there is no need to panic. Essential government services like our police, our fire, our transit, and sanitation will continue. So your garbage will be picked up. Police officers will be out there on the front line. Our fire safety officials and others. Also, grocery stores and pharmacies and banks and gas stations will remain open. Restaurants will be open for takeout only. But non-essential stores like bars and gyms will close effective midnight tonight. So my fellow San Franciscans, what we are asking for everyone to do is to remain at home for all but the most essential outings for your safety and the safety of those around you. Dr. Colfax will provide more details. But I want to also be clear, again, this is not a time to panic. We are not closing grocery stores. When you need to go to the grocery store to pick up prescriptions, or please also practice social distancing by maintaining at least 6 feet of distance from others. Continue washing your hands and cleaning high-touch surfaces. We know that this will have an even larger impact on what we've already put into place. And we will continue in this city to do everything that we can at the local level to support those who will continue to be impacted. I also want to express that this directive is coming from our county health experts. This is not just happening in San Francisco County, it's happening as we speak in Contra Costa County, Alameda County, in Santa Clara County, and Marin County. So the Bay Area as a region is coming together, understanding the significance of the impacts of the coronavirus for the purposes of making sure that we are keeping people safe. Because we know in San Francisco, we can't do it alone. We have to work together, and our public health experts, which, as I've said in the past, are some of the best in the world, are advising us to take these additional steps to ensure public health. And we will continue, as we have done, in addition to protecting public health, taking into consideration the impacts of these decisions on our economy. We will continue to do everything we can to protect our residents, our workers, and businesses through these challenging times. This morning, we announced the Workers and Families First program, a $10 million paid sick leave package for workers impacted by the coronavirus that are not city employees. We provided advanced paid city sick pay for city employees as well. This is in addition to the measures we've announced, like deferring our business taxes and licensing fees, launching a relief fund for impacted businesses, supporting nonprofits funded by the city so that workers don't lose their income, working with partners in the philanthropic and private sectors and advocating for state and federal funds, putting a moratorium on residential evictions. And here's the thing, we know that there will be more that we need to do. And so we all clearly, along with many of the department heads that are with me, a number of city leaders, elected officials, we are all coming together to put forth the kinds of initiatives that will help us get through this very difficult time. I want to encourage employers and employees who are impacted to visit www.oewd.org/COVID-19 for more information and available support. If you have any questions or concerns and need access to information, you can also call 311. Again, let me reiterate that the time now is not to panic. It's for us to come together. It's for us to follow the directives. It's for us to do everything we can in our respective capacities to prevent the spread of the coronavirus so that we can get over this very challenging time. Ultimately, we will. So we're talking about what might be considered long time, but a short-term inconvenience for the possibility of having a more significant impact as it relates to our public health system. So we are grateful for your support. We ask for your cooperation. This will go into effect through April 7th and could be amended to either be shortened or lengthened depending on the advice from our public health experts. So at this time, to provide more details around what this means and how we will be impacted county-wide in San Francisco, as well as the entire region throughout the Bay Area, I want to introduce Dr. Grant Colfax.
Thank you, Mayor. Good afternoon. I am Dr. Grant Colfax, Director of Health for the City and County. As the coronavirus situation continues to change rapidly in our city and region, I want to make sure that all San Franciscans understand that we are entering a new phase in our response. Our response has always been grounded in data, science, and facts. That continues to be the case today. As we look at the patterns in our country, state, and region, we are seeing rapidly escalating cases and serious illnesses due to coronavirus. This requires an escalating response. The evidence tells us that now is the time to implement this step. Today, we are ordering that everyone in San Francisco who can remain at home until April 7th. This is a critical intervention that we know can reduce harm and save lives. The coronavirus is spreading in our community, and we need to slow it down. Over the weekend, Bay Area County health officers from 6 counties conferred and agreed that this step is needed immediately. Based on what we can predict, now is the time to do everything we can to prevent the situation from getting much worse in a matter of days or weeks. Every hour counts. With everyone cooperating with these orders, both locally and regionally, we will be able to adjust to the new rules over the next few weeks. We know that there will be a lot of questions and concerns at the beginning of this. We are committed to providing the most clear and up-to-date information you and everyone needs. We will have frequently asked questions on the SFGov and Department of Public Health websites, bus shelters, and radio ads, and we will continue to update the public through the media. And please do not rush to urgent care or emergency rooms for COVID-19 testing or non-emergency needs. Do not overwhelm the health system or the emergency response systems at this time. We need these services to care for those who are seriously ill. If you are otherwise sick or concerned you may have coronavirus, please contact your healthcare provider. In fact, I urge us not to rush anywhere. With this order in place, you will still be able to get food, care for relatives, run necessary errands, and conduct the essential parts of your lives. You will still be able to walk your dog or go on a hike alone or with someone you live with, or even with another person, as long as you keep 6 feet between you. Grocery stores, gas stations, banks, laundromats, utilities, and other essential services will continue to remain open. Restaurants will continue to do takeout or delivery. Please be patient and kind to one another. Stay informed with the facts and don't propagate rumors or mistruths. Together, we will get through this, and our families' and communities' health will be better protected. During these next weeks, the Health Department, the Department of Emergency Management, and all city agencies will continue to respond to the coronavirus outbreak. This work is essential, and it must go on. For the Health Department and our partners, we will focus our attention on our top 3 priorities to fight the spread of the virus, to decrease harm and save lives. The first priority is to reduce community spread. The virus is here in San Francisco. We must practice social distancing to slow it down. This order escalates that response. Another priority is doing everything we all can to protect vulnerable populations. That means people who are 60 or older or who have certain underlying health conditions. These are the people who are most at risk for getting seriously ill and dying if they get coronavirus, the condition COVID-19, which is caused by the coronavirus. Third, we must protect healthcare workers. Across the city, healthcare workers and first responders are courageously on the front lines, keeping our community healthy and safe. We must provide them with the support, protection, and supplies they need to respond to coronavirus. This is the work of public health. Nothing is more important for our community today. We greatly appreciate the way the city is coming together during this emergency. Under the leadership of Mayor Breed, city agencies, businesses, schools, the healthcare system, and individuals are stepping up to do their part. All San Franciscans, please do your part. Abide by the new health order. If you do have to go out, practice social distancing. Stay 6 feet apart from others and wash your hands frequently. Check in on your neighbors. Do not leave children who are out of school with elderly relatives, if at all possible. Do not go to emergency rooms unless you have a true emergency. Take care of yourself and your loved ones, and make a plan for how you will manage the changes that are upon us. I know this is a lot to take in, and I and the department are committed to providing all San Franciscans with as much information and guidance as we can to help you do your part. Today's decision was reached collectively, and the entire region is acting as one. We will be developing more detailed information as soon as it is available. And again, please stay up to date by visiting the department's website or SF.gov. And today, if you haven't already, sign up for the text alert service. Text COVID-19 SF to 888-777. That's COVID-19 SF to 888-777. I know today's order is a radical step. It has to be. We need to act now, all of us, to protect the public health. Thank you.
Thank you, Dr. Colfax. And before we open it up to questions, I want to introduce President of the Board of Supervisors, Norman Yee.
Thank you, Mayor Bree. I want to thank you for your leadership, and I want to thank the leadership of all 6 counties coming together to fight this pandemic as a joint effort, because it can't be isolated. I want to also acknowledge my colleagues. As you see there, almost every one of them are here. Supervisor Safai, Supervisor Walton, Supervisor Mandelman, Supervisor Stephanie, Supervisor Peskin, Supervisor Marv, Supervisor Ronan, Supervisor Preston. We're here standing together with the mayor, and I want to thank all of them working in unity with the mayor's office to respond to this. I want to thank the mayor once again to be aggressive about this effort. This is not a game at all. I want our seniors in particular and people that are most vulnerable to take this seriously. We could give orders, but if you don't follow it, it's useless. You all must do your part. We all must do our part. That's what we need to do. Now, the mayor has rolled out many initiatives already to the press, to the public, saying these are some of the things that we're going to do as a city to help the small businesses, to help people that are residents in San Francisco. Those are great ideas that were generated by all of us standing behind me. And I want to say two other things. Those ideas are not the only ideas. And we will continue to find other policies that can help our population in San Francisco while we are all sitting and being impacted by this one way or another, whether it's economic, whether it's emotional, and so forth. So on Tuesday, we're going to continue that discussion to see what else we could do, what other ideas we could come up with. And I'm happy that we'll take that initiative to work together. The other thing I want to say is that during this emergency, it's so important that the Board of Supervisors membership, my colleagues, are well informed. So, because as you know, many of the residents come to our offices for information, and we need to communicate back both ways to the Department of Emergency Management. or EOC, to make sure that there's strong links, strong communication that goes on between us, and we're going to work on that also. So I want to thank once again Mayor Bree for your leadership in this. Thank you.
Thank you, President Yee, and thank you to all the members of the Board of Supervisors for joining us here today. As I said from the very beginning, the priority in making these decisions is public health. I know this has been very, very difficult for so many people, and we will continue to do everything we can with a number of initiatives to mitigate the impacts on our especially very vulnerable community, not just the vulnerable communities of people that we know are at risk of contracting the coronavirus, but also the people who we know might be suffering financially. We got a lot of work to do. We will be continuing to do that every single day and provide initiatives that we know we can actually deliver for the people of San Francisco. So I thank you all again for being here. I thank you for your patience and cooperation. This order will go into effect at midnight tonight. And again, I want to say, do not panic. The grocery stores will remain open. The gas stations will remain open. The banks will remain open. The pharmacies will remain open. There's no need to rush out to do things at these particular locations because they will be available to you. And so at this time, we'll open it up to questions. But again, our goal is to try and mitigate the impacts, as we have said time and time again, provide essential services to the public to the fullest extent possible, provide mitigation around the economic impacts on what we know impact people's lives on a regular basis, especially those who sadly have already been laid off because of the lack of business for various restaurants and other places, and we know there's more to do. But I will say that I'm really proud of the leadership here in San Francisco because we are ahead of the curve in comparison to so many other cities throughout this state, throughout this country. They are not even close to doing many of the things that we have already put in place in San Francisco. There will be more to come, and I thank you again for your cooperation, and thank you to all the public health officials and others who have really stepped up and provided the most meaningful support during a very difficult time. And so with that, I'm happy to open it up for questions. Christian.
Enforcement. What does enforcement going to look like? We're going to see San Francisco police, sheriff's deputies, Department of Public Health workers going around making sure businesses aren't open. What is that going to look like?
I'm going to let Chief Scott answer some questions around enforcement.
Thank you, Mayor Breed, and I again also want to thank Mayor Breed for her leadership. So enforcement, we're going to take a compassionate, common sense approach. We're looking for, number one, education. The mayor has been very clear to all of her leadership team that we need to get the information out to the public about what this is all about. Don't panic. We're going to have frequently asked questions that will be published to the public. We're looking for voluntary compliance. We're asking the public to voluntarily comply. Now, this order by law is enforceable as a misdemeanor or failure to comply with it, but that is an absolute last resort. And I want to be clear about that. This is not about, a criminal justice approach to a public health issue. This is about educating the public. This is about social distancing and practicing those safe protocols, and we will be a part of that education process. If we do get called to those situations, we're going to try to educate the public and point out why we are doing this, and we are asking for voluntary compliance. Yes, by law, enforcement is an option, but that is not our desire. That is not what we intend to do. We intend to adhere to the spirit of what this is all about and keeping people safe and keeping this virus from spreading. So we will do our part. Thank you.
I'm sorry.
Does that mean the food delivery by bicycle will be banned too?
We're not putting a ban on food delivery.
Homeless and cats. Homeless don't listen to too many people. How do you deal with that?
So We are still working with the governor's office to not only make sure that we have places for people who are homeless to self-quarantine, but we also know that in this challenging time that the homeless, along with our other vulnerable populations, fit into a vulnerable population. And our goal is to provide some additional resources that we are working on now. We do have locations just in case there is someone who is diagnosed and may not need hospital service but may need to self-quarantine. It is something that we are continuously working on, and we'll provide more information about that when we have all the details.
Essential, and also flying to the airports, what about travel?
Dr. Colfax, you want to?
So under this order, all but essential travel will be restricted. And your first question was about the media's role, an absolutely essential role to communicate effective information, the accurate information, and to push back against rumors. And again, I know this is a radical step, but also essential services will continue. So ensure that people understand that they will be able to support themselves and their families, get the vital resources that they need during this time, and that this is an evidence-based intervention in terms of making sure that people stay at home as much as possible to prevent the spread of the virus. This is an evidence-based, science-based intervention. Thank you. So at this time, in compliance with the order, people who leave the county during this time would not be, except for essential travel, again, essential travel, would be out of compliance coming back between now and April 7th. People who are currently out of the county would be able to return at this time, but really going forward until April 7th, essential travel is only allowed under the order. Thank you. So as I said, protecting healthcare workers and first responders is one of our top 3 priorities at the health department. I don't have the numbers to share with you in terms of the number of healthcare workers who are quarantined, but we do know that they are at high risk for exposure, which is why we're working with everyone across the city, hospital systems across the city, to prepare for the potential for a substantial portion of the workforce to have to be under isolation or quarantine. One of the key things that we're working on is ensuring that there is adequate personal protective equipment in keeping with World Health Organization and CDC guidelines, so that we can keep the workers as safe as possible so that they can care for the people who are most vulnerable to this disease. We are more prepared than any other jurisdiction that I'm aware of. We have a robust healthcare system, and everybody is stepping up.
What about tourist visitors, people coming into the city? Like how what they're doing here?
That will be posted on the frequently asked questions.
What services in City Hall are going to continue and what are going to be restricted?
Essential services will be continued. Essential city services will be continued both at City Hall and across the city.
But presumably there'll be a fact sheet to tell people.
We will be, that will be provided, absolutely.
Are you short personal protective equipment right now as you face this? Are you going to need more help from the state or from the federal government? Where is the stuff?
Every local jurisdiction needs more personal protective equipment. I cannot emphasize how important that is, given the escalating response and the need to protect our healthcare workforce. We have asked at the federal level for more visibility in terms of what is actually available. All local jurisdictions that I have talked to and I'm aware of are working under a short supply. This is a key gap in our ability to collectively respond to the epidemic, and we have been working locally and regionally and at the state level to advocate for developing more up-to-date guidelines with regard to what is the necessary protective equipment, and also to make sure that we have a clear sense of what is available going forward. Personal protective equipment is a vital part to this response, and I want to ensure that we are able to keep our healthcare workers protected with the best evidence possible so that they can do their job.
I know you said restaurants are closed except for delivery. Not to quibble or to get too far in the weeds here. Does that include takeout? When people come in and get takeout, what about coffee shops, those kinds of businesses?
Under the order, takeout will continue, and coffee takeout, as long as the social distancing is maintained under the order, that would be permissible.
Janitorial services in the big buildings are essential work or?
We will post the essential activities on our website with frequently asked questions. I will say that cleaning is especially important for all of us during this period of time. So frontline workers include the courageous janitors who are doing the work of cleaning and keeping us all protected.
What is the plan for those folks who do not have cell phones? You send out a text alert, or how do you get in touch with those who are not as connected as everyone else?
So we have a ad campaign that will be on radio and TV and print media. We are today switching all of those messages as we speak, and those you'll be hearing and seeing and be able to read those as of today. Yes. So all of that is out. You can either go to sf72.org or sfdph.org, and you will find all of that material ready to print and share.
And I just want to add that also there have been a lot of nonprofits that we've partnered with to distribute information in various languages all over the city, so that information has already been going out. Thank you.
Dr. Skinner, you get hand cleaner. What are you doing to work with the supply chain with the public where they can access what they need?
Thank you for your question, but Greg, it's not just about hand sanitizer. Regular soap works just as well, so I'll let Dr. Colfax answer the details about the supplies.
So I would just reinforce what the mayor is saying about soap and washing your hands is one of the key interventions, if not one of the most effective interventions we can do to reduce risk. Hand sanitizer, we're working with all of our supply chain operators locally to ensure that we have as much available as possible. We work with what we have, and we're trying to get more. Thank you.
On Friday, the president announced what was supposed to be a national website where people could input their symptoms and be taken directed to the closest testing site to them. There's been talk that he sort of over-exaggerated what that website would be, and it's now supposed to be a pilot program that actually just includes the San Francisco Bay Area. Has the city been in communication at all in terms of how this website will work?
So we have been in very preliminary conversations with a company. I don't have specifics to share at this point, but they are working with us and a couple of other counties to try to develop a pilot. I would emphasize that this is a pilot intervention as we understand it at this time, and we want to make sure that given the national limitation of test kit availability, which has really hobbled our local ability to respond, that those tests are reserved for the people who need the test the most. I don't have, if I could give that to you, I would. I don't have that timeline. That hasn't been established yet.
And just to be honest, we can't sit back and wait for the federal government to do anything. Unfortunately, they've not been as proactive as they should in recognizing that this is a crisis throughout the entire world. As you know, I sent a letter to the Vice President 2 weeks ago around the lack of support for test kits, around protective equipment, around their very terrible response in dealing with this. But sadly, now is not the time to point fingers. It's the time for us to come together and to provide as many resources as we can here locally in order to protect public health, and we hope that people will cooperate with us.
Reaching out region-wide, because if bars, restaurants are closed here in San Francisco, somebody can just drive down to the city or North County or to the East Bay. If you can talk more about what's being done for a region-wide effort, are you in communication with supervisors in other counties? What's being done?
So the public health officers for the counties that I listed are all in constant communication and are the ones who put forth this specific directive. And so they are definitely in touch From my perspective, I'll let Dr. Colfax talk specifically about what that entails. But we, as mayors, as leaders of the city, we are in constant contact along with the governor's office in order to provide coordinated responses for the suggestions or the mandates that are coming down from public health officers. So there is a coordination that is happening around the region as a result of this particular situation, and we're working together, and we're working directly as well with the governor's office, who's been very supportive in our efforts. And so I'll let Dr. Colfax talk about the public health officers and their coordination and response.
So thank you, and I think it's really key to emphasize how important this regional response is. From the data that we're receiving from other countries, we know that a regional approach must be taken, particularly with regard for social distancing, for it to have an optimal impact. Over the weekend, the health officers from the nearby counties came together, shared data information about what we were doing, and made a commitment to working regionally and collaborating and really working lockstep towards this order. While the order released today is specific to San Francisco, the order reflects the concepts that are being implemented and executed across all 6 counties, and the timing of the order and the effect of the order, the date and time that the order is effective is consistent across the 6 counties.
Any main change related to the transportation? So bar keeps running, buses keep running?
There'll be a press availability with the director of MTA, Jeff Tumlin, at 3 o'clock today to provide details on Muni and our transportation system here. We unfortunately can't speak on behalf of BART.
I have a question from Chief Scott about enforcement. If we have essential workers going to work, do they need to bring documentation where they're working if they are stopped? How does that work? We've seen some pretty strict rules in Italy and Spain over this whole thing with people, essential workers going to work. What do they need to keep on them to make sure that everything's done?
Well, the first thing is if we are practicing the social distance requirements, the likelihood of somebody being stopped is very, very extremely low, unless they're doing something else. And if they're called in as a disaster service worker, they would need to have the regular credentials on them, but that's easily explainable. As I said, you know, we're taking a very common sense, compassionate approach to this. We understand that certain things have to happen, and we have to have essential services in our city, and our officers will be very thoughtful about that. But if social distancing is being practiced, there's really no reason to stop anybody. Thank you.
So thank you all again. I just want to express that I know we said that a lot of this information is online, and we also realize that not everyone has access to the internet, and so 311 is also a tool. And I want to reiterate that this is not the time to panic. If people have questions, they have concerns, they can call 311. They can look at the Department of Public Health website for any questions or any other concerns. We are here to provide as much information as we possibly can to help every resident of the city get through this very difficult situation, which is something that, again, we have experienced, maybe not in this magnitude, but we have had challenges before, and we have become a more resilient city as a result of those challenges. We will emerge stronger and better because of this. Please cooperate with the order. Please continue to work with us to comply so that we can get through this sooner rather than later. Thank you all so much for being here today.